welcome back in. It is 8:23 this morning. And do you find yourself sneezing around the Christmas tree or dealing with allergies this time of year? With Dr. J.T. O'Neill, he's an ENT at Walker Baptist Medical Center. Grew up in this area, went away for a while, but he's back home. Good morning.
Hey, good morning.
Good to see you.
Thank you.
So do you deal with allergies? I don't deal with them a lot sometimes, but I know a lot of people really suffer with them.
They do, especially this time of year. It's a little strange. People think it's only a spring or summer thing, but
right.
I see lots of allergies in my patients this time of year too.
So what is going on this time of the year? Why do we deal with it during the holidays a lot?
Absolutely. Well, it's cold outside. You know, we had that snow, and people go inside, and there's lots of allergens inside too. There's dust, mold, pet dander. So when you're inside, you don't get outside, you get exposed to a lot of those.
So is it literally just because we're inside more often?
Absolutely. You get poor air circulation. You know, you see the dust bunnies rolling around, and it tends to affect people's allergies.
All right, well, let's look at our next question here. And our next question is, what are the common causes? Well, you kind of alluded to that.
I kind of went over those. You know, allergies are different for different people, but the ones I see most commonly right now are mold, which can affect you any time of year. Dust, it seems to be worse when you're inside more. Some people are actually allergic to Christmas trees, so you get a tree in, it smells good, but then you you seem to get more runny nose. That
would be awful to be allergic to the Christmas tree.
It seems like it would be.
Apparently people do that, right?
They do, but the good thing is there are ways to treat it and make it better.
And the next thing you talk about, some of the things that we can do, and you mentioned a couple of those, but these are interesting. Wash sheets with hot water, I guess because that kills off whatever was on there more than just a cold water wash? It
can kill mold spores, which can help. All the data shows that if you're going to do what's called environmental ways to try to treat allergies, you have to go all out. So you have to wash your sheets weekly in hot water, buy HEPA filters, a HEPA filter for your vacuum cleaner, and make sure you change it at the recommended intervals.
So can you not be allergic to like pet dander, but it still bother you? Is there a difference, or if it bothers you, you are allergic?
That's very insightful. It's true. There's people that have actual allergies in their bloodstream where their immune system responds to different allergens. There's some people that it can overwhelm the inside of your nose, and you can still get symptoms even if you don't test positive to a specific allergen.
All right, so if you let these go and you don't get help with them, what happens, or can anything happen? Absolutely.
Our nose is meant to kind of clear allergens and bacteria, and if it gets stopped up inside your nose, you can actually develop bacterial rhinosinusitis. If these symptoms last for more than about a week, you probably need to go see your doctor, because sometimes you can need something like a steroid or an antibiotic.
All right, we often talk about our skin being drier in the wintertime. Most of us attribute it to the dryness. We're in heat.
Right.
Is that it, or can it be allergies?
It can be both. You know, when you take warm showers, it can dry out your skin, so you need to make sure not to take the showers quite so hot. You can use a good cream-based lotion. But it can be allergy-based too, especially if it happens after eating a specific food or being around a specific substance. You can take things like antihistamines, Benadryl, Zyrtec for that.
Is it easier now to be tested and find out what you are allergic to than it used to be?
Absolutely. There's multiple ways to do it. You can actually do a blood test where you only draw blood. You can also do a traditional, what's called intradermal testing, where you get small pricks and you see specifically what you're allergic to. Some people can be treated with just medications. Some people actually need allergy shots or even surgical interventions in order to get good control.
All right, I hope that addressed some of the concerns that many of you may be having this time of the year when you are dealing with allergies. Dr. O'Neill, thank you.
Yeah, thanks for having me.
Good to see you.
Yes.